guys, Lauren here with BIZROK. In today's video, I want to talk about an amazing tool that you may or may not have heard me talk about over the years, but I want you to jot this down because it does have a special order. There are 3 words, okay? It is the feel, felt, found technique. So that's feel, F-E-E-L, felt, F-E-L-T, and found, F-O-U-N-D. Feel, felt, found technique. So, from a dental standpoint, this is a really, really great way to calm a patient down who maybe they're nervous before a treatment, and you're trying to calm them down. You're trying to tell them that, hey, we're the right practice for you, but we want to make sure that they feel taken care of. Now, with this technique, you do follow feel, felt, found in that specific order. So that's why I wanted you to write it down. So if you haven't done that, go ahead and jot it down so that you can follow along with me, okay? So let's start off. Let's pretend that we have a nervous patient who maybe they're in our chair and we just told them that they need to have a root canal. And the patient's like, oh my goodness, like I've never had a root canal before. I'm super nervous. I don't know if I feel comfortable doing that. That sounds like a big deal. Well, following the feel, felt, found technique, you can really calm that patient, but also make them feel comfortable and confident that other patients have felt that way too, but you're here to take great care of them. So let's walk through it together, shall we? So you might say, we'll call her Susie, because you guys know my favorite name is Susie. So you might say, the patient says, hey, I'm really nervous. I don't know if I feel comfortable with this. So you'll say something like, Susie, I completely understand how you feel. Many patients have felt nervous before getting a root canal, but found that they were so glad that they moved forward with it because it got them out of pain and it moved them to a positive direction with their overall oral health. Feel, felt, found. Now, if you listen to my verbiage, I would encourage you to hit pause, stop, or rewind. I said, I understand how you feel. So you're showing sympathy for your patient. Other patients felt the same way. So you're telling that patient it's okay. There have been people just like you in your exact same shoes, but then they found that they were glad they moved forward with that treatment. So, it's a really, really great segue to make your patient feel comfortable and confident before moving forward with something scary like, a root canal. From a customer standpoint, maybe you have a customer who is upset or frustrated or something didn't go well. And so you can also follow this formula too. Listen to your customer, listen to how they sound. Are they upset? Are they angry? Maybe it's an angry patient. You want to make sure that they feel comfortable. So you might say something, thank you so much for sharing that with me. I completely understand with how you feel. Many customers have felt frustrated before, but found that they were really glad that they worked with us to create a solution together. Again, you're acknowledging, you're creating sympathy, you're telling that customer, I understand how you feel. You're saying, hey, others have gone through this too, but found that they were glad that they moved forward with us or that they worked through this with us. It's a really, really great way to humanize the conversation with your customer, but also to make sure whoever's in front of you, to make them get over that hump and let down that wall of anger or anxiety and make them feel comfortable and confident about moving forward. So I would encourage you to practice this. Write it down, role play it, go through, check, even if you have to check mark on a sticky note, okay, I said feel, I said felt, I said found in that order. And if you role play it over and over again, it will become part of your normal vernacular. So you want to practice this, but you also want to use it like a tool. Remember, I don't teach scripts, I teach tools, and I want you to feel comfortable using any tool that's thrown your way based on what kind of issue pops up or question comes your way. And that will create a successful relationship with your customer or your patient.